As we're in spring and moving to summer, obviously we're very keen to make sure that New South Wales is as open as it can reasonably be in a COVID environment. As Health Minister, I'm delighted to be able to confirm that at 1 minute past midnight, the lives of those people who live within the border zone between us and Victoria have now got much more freedom, and that's what New South Wales is about. Prior to midnight last night, of course, Victorians could only cross into the New South Wales side in the bubble for 4 reasons. Effectively for education, employment, health and care. As of 1 minute past midnight, life has returned to normal for the people in that bubble zone. So now people can go to their favourite restaurants, go to their favourite clubs, do whatever they want to do. But with a proviso, we are still in a COVID environment, and I just want to say to the community down there, we're with you, but we also need you to be with the government and to make sure that if you do have any indications at all, the slightest indications of a flu-like illness, coughs, colds, temperature, go and get tested. We want to keep you safe. We want to make sure you have a good, open life, but we need you to be partners with us. So as long as that continues and as long as people take those precautions, then looking forward is very positive for our Albury-Wodonga area, but for the entire border, from the Pacific to the border with South Australia. It really is a case of government's here to help, but we need the community to help us and be tested. Thank you.
From a health stadia announcement, can you explain yourself or maybe Dr. Chan what's going to be happening at the smaller stadia as well, whether there's moved to increasing capacity or not? And the advice on people being expected to wear masks on their way in and just standing, is that expectation to wear a mask something that we might see built into other scenarios where people are strongly encouraged to wear a mask?
In terms of the larger crowds, obviously with a larger crowd, risks increase. And so we'll be asking the various sporting event organisers to make sure that as part of their contract with the public, they keep the place safe. And the way to keep the place safe is to ensure that when the ticket is sold, they know that they will be required to wear a mask until they go into the seated environment. We know, the Premier said, the 4 square metre rule, the other safety measures that our entire community knows and has worked so well at in the last few months will be carried on. And then the mask won't be required once you're seated, because that's a much safer environment. I'm going to give you 2 ministers here, so I'm going to ask Minister Ayres to answer the second part. Minister Ayres.
Today's announcement around 25 to 50% specifically relates to 3 venues: ANZ Stadium, Bankwest Stadium and the SCG. New South Wales Health and the venue operators for Penrith Stadium, McDonald Jones Stadium in Newcastle, the Ken Rosewall Arena at Sydney Olympic Park and WIN Stadium in Wollongong are undertaking further work. WIN Stadium, Newcastle Stadium, Penrith Stadium all have hills. We want to be able to make sure that we work through what is the most appropriate way to open up that venue and what is the right way to have the seating configuration if we go to a larger crowd. So that work is still undertaking. We're hopeful that we'll be able to get to those venues being able to open at larger capacities, but we want to see COVID-safe plans put in place for those specific venues. And Ken Rosewall Arena at Sydney Olympic Park is an indoor arena that we want to be able to do a piece of work on to undertake how people move in and out of that venue. We've got the ATP Cup forecast for that venue in January, so there's a bit of work being undertaken there. These dates, today's announcement starts on the 1st of October, and we'll be working on those smaller venues between now and then, hopefully getting to that date, but a COVID-safe plan will be absolutely critical for all of those other venues. Yeah, we're going to work very closely with the venue operators and health. Local health districts have been very, very important in understanding the local terrain. We want to be able to provide as much information as we possibly can to allow those COVID-safe plans to be put in place. Optimistically, I'd like to say that they'll be open by the 1st of October, but we won't be making decisions to put people in unnecessary risk. So if those COVID-safe plans don't meet the standard, those venues won't be able to open for the NRL final series.